everybody, and welcome to Coastal Living. We have another fantastic show for you all today. As usual, every Wednesday you can expect the doctors to be in the house with our friends at South Texas Brain and Spine. We're always excited to learn more from them. We're also going to address our mental health. It's important to keep that at top of mind and make sure that you are taking care of and prioritizing your mental health. So we've got that as well. Let's go ahead and throw in some physical health. I'm going to share one of my gym leg days with you guys to help you become familiar with the equipment and try to understand what muscle groups were working and how to do it properly. We've got a lot to cover, so thanks for joining us. It's Coastal Living.
The exact cause is still unknown, but around the world, more strokes are striking younger adults ages 18 to 49. Rate of stroke deaths among middle-aged U.S. adults hit a nearly 2-decade high during the COVID pandemic, according to the CDC.
It certainly is concerning.
Dr. Abbas Karal led research at Cleveland Clinic to figure out why younger patients he was seeing were having something called large vessel occlusion, which can cause an ischemic stroke, meaning a major artery in the brain is blocked.
The strokes that happen as a result of large vessel occlusion really happen because of plaque buildup, what we call atherosclerosis. And our study actually showed that those with strokes from large artery atherosclerosis or plaque buildup actually did worse after treatment.
Karal says that buildup can come from risk factors like high blood pressure, high cholesterol, diabetes, smoking, a sedentary lifestyle, and unhealthy dietary habits.
That's why it's very important to make sure that even younger adults are seeing their primary care doctors, getting checked for those stroke risk factors, and if they have them, to make sure they're as controlled as possible.
Karal says all adults should also know stroke warning signs like eye or gaze deviation, one-sided weakness, arm or leg weakness, facial droop, and slurred speech. If these symptoms are present, get emergency help.
No age group is immune to stroke.
For Health Minute, I'm Mandy Gaither.
So are you really being present when you're constantly engaged in your technology device like your cell phone, your iPad, or any type of tablet or laptop? More than likely not. You are actually taking yourself away from being present. You're not taking time to soak up all of the beauty that's around you. You're not engaged in your present moment. You're not noticing how the wind feels as it hits your skin. As I'm sitting out here in the rain, you know, I'm noticing how cool the drops feel as they touch my skin. I'm noticing how the breeze feels as it brushes past my hair. When we are constantly engaged in our phones or other types of devices, we actually are disconnected from our present moment, and we're more engaged in the content or the activities happening with the device. So I would just like to encourage you to put the phone down for a while and just take time to soak up the present moment around you. Feel the rain, feel the breeze, enjoy the sunshine, connect with nature. Just do something that allows you to stay connected with yourself, with the present moment, with those around you, and let's give these devices a little bit of a break for a while. It's okay to take about 5 to 10 minutes away from social media, or give yourself about a week or two to do a good social media detox. Setting those boundaries to help yourself really be in control of your life in a present-minded way so that you can live life more mindfully, more engaged and connected with the surroundings and the environment and the happenings around you. So let's say bye-bye to this for now, and we'll just enjoy the present moment around us.
The doctor's in the house, and I'm here with Dr. Alexander at South Texas Brain and Spine Center. Now we've got some really cool technology in front of us, and this is going to help us with pain management, I guess, when we've got kind of reached the point of no return or we've undergone a very serious surgery and we still have that chronic pain. There are some solutions for that. Is that correct?
Yeah. Some patients reach a point where their pain is taking over their life. And pain can be very, I don't know if you ever had a toothache or a backache, you know, even as a physician, you got to empathize. Like I pull my back a little bit or have this toothache and all you think about is that pain. So patients who've had spinal surgery or they have had trauma to their spine or even patients who've had multiple sclerosis, there's treatment options that we have that are very, very amazing how they can change their life.
Okay, very cool. We've got something interesting in front of us, and I think we've seen these before on the show, but we're going to sort of talk about how these can apply to a variety of issues that you may be having.
So typically we work with a pain doctor in town. For a pain pump, they would usually do a trial. They would do a spinal needle, a lumbar puncture. They inject the medication they want to try the patient on. So they try like morphine. Or if it's for spasticity, so patients who are very spastic from multiple sclerosis or a stroke, they put the baclofen in intrathecally, so within the spine, and they test you within a couple hours and see if you're more looser or if your pain is more manageable. So we do a trial, we make sure they can tolerate the medication, and then typically we would implant a pump. So a pump is like this, it goes into your belly, and then this catheter goes into your spine, and we tunnel it under the skin, so this can deliver the medication in microdosing. 70 to 80% of the medication is degraded by your liver, so you need higher doses. And also nowadays, with the narcotic opiate crisis, they're getting away from oral medications. Patients are, and even doctors, even pain doctors, don't want to give pain medications out anymore. And it is highly addicting, and we want to really decrease that. So you're able to give an opiate, very, very low dosing, to the pain receptors in the spinal cord.
Directly where it needs to go.
So then you can bypass the liver, low dosing. It's not as, you know, some patients have, it's almost a miracle for their life. So this is another device for patients who failed surgery. So they've had back surgery or they have something really peripheral neuropathy, if they have things that are not fixable or correctable with medications. So the pain doctor or we usually do a trial. They put an electrode in the spine, and the patient will go home for 3 to 5 days with a little battery pack on the side, and they'll know if it helps with their pain. So if you want at least between, I would say 50 to 60 to 70% or even more, and also you want to decrease your amount of pain medications you take to cure the pain. So it's amazing how technology keeps evolving and how we're able to really treat patients who have failed all conservative treatment options.
So again, I love these visits because we do learn about what the possibilities are if you find yourself in these situations, and it looks like there's some relief on the menu for you. So if that's the case, reach out to our friends at South Texas Brain and Spine Center. Another thing we just discussed is if I make an appointment with you, I'm going to see you, right?
Yes, I'm very anal about seeing my patients, so I usually see my patients, and then the PA will have an assistant. He also will see the patients, but I always see my patients there and make sure that we have a good treatment plan.
Very good, very promising, and you know you're getting it straight from the source. So when you visit, of course, mention Coastal Living sent you. It's Doctor in the House. Thank you again.
Thank you.
Coastal Living's Doctor in the House is paid for by South Texas Brain and Spine Center.
We're off to a great start, but don't go anywhere. Part of achieving those goals for your wellness and health include your diet and your exercise. So we're going to give you tips on how to pick the right trainer and why you should be drinking more water. Some of you guys are like, duh, and the rest of you are like, I hate water. We'll cover that and more when we return on Coastal Living.
Every year, millions of people pick a few things they want to achieve or improve on.
More often than not, these goals include some version of self-improvement relative to our physical health. Now, as the months go by, we realize we're back in our same routines and not much has really changed. One of the biggest reasons people fall off the wagon is because they don't have someone to hold them accountable. This is why, for many of us, finding a trainer can be super helpful in attaining those goals and turning them into lifelong habits. However, not all trainers are the same, so here are a few tips to help you find the perfect trainer to help reach your goals. The first and most important thing is to check your trainer's credentials. Make sure they're certified and ask for before and afters, or look for testimonies from other clients to see if you may be the right fit. You also want to identify any special needs you may have. It's critical to inform your possible trainer to see if they have experience working with, say, a back injury or anything like that. Exercise can help relieve symptoms and medical conditions, but bad choices and a bad trainer can make those problems worse. Lastly, understand what kind of push you're looking for. Some people want to be pushed to their limits by that drill sergeant type, and others are going to work a lot better with positive reinforcement and gentle encouragement. Your trainer should fit your personality and motivational style. Don't be afraid to interview multiple trainers to ask a ton of questions. At the end of the day, you're paying these people for a service, and you're the one who needs to be held accountable for the results. So find yourself a good trainer and get started today. I believe in you. You should too. We've all got big plans for the upcoming year, and one of those may be to incorporate a healthy diet and exercise. However, the gym can be pretty intimidating, especially if you aren't familiar with some of the equipment. Today I'm bringing you to my gym, and I'm going to work you through a quick little leg day workout. As you can see here, this woman is doing a great job, but she's a little wobbly. That's because she probably didn't stretch. It's so important to identify the muscle group you're going to work and get in a good stretch so you don't accidentally injure yourself. Full body stretches are really great, but again, we're doing a leg day, so you want to stretch out those hamstrings, do some deep breathing, and really breathe into those muscles to extend them and make sure you're nice and limber. So you want to get in some good movement. Here we're doing a quadricep stretch, so you're just going to grab the wall for support and grab your leg to stretch that muscle. Again, breathe into these movements and give yourself a good 20 to 30 seconds in each stretch, whether you go back and forth or if you just stay in that stretch one time. We're starting with a lying hamstring curl. This is a really great option in the gym. It's going to help you maintain your form. Again, you want to start with about 20 reps to warm up, followed by 3 or 4 working sets. Those are sets where you're activating your muscle, trying to get at least 10 to 15 repetitions. So every time I move my legs, that is a rep. This is a leg extension, great for the quads. So if you're looking to bulk up your legs or just create more definition, if you got thick thighs like I do, you probably want a little bit of definition in there. And as you can see, every time I bring my legs up, my quadriceps are popping out. So the more I do this exercise, the more definition you're going to see there, which adds to the shape of the legs. My gym bestie let me film her here doing a hip thrust. This machine can be very intimidating, but it's not as hard as it looks. Of course, you want to start with a light, realistic weight and work your way up. Fun fact, the heavier you lift, the bigger that muscle can grow. So if you're looking for mass, you do want to work your way up to a heavier weight. However, this is an option as well. Here I'm doing a modified version of the same exercise with lighter weight. You can lose the weight completely, focus on your body weight, and even put one leg over the other so that you're focusing on one leg at a time. This is really great for balance, and again, if you're using body weight, it's a great way to challenge yourself while focusing on form to make sure that you can complete that. Next, we move back to the hamstrings. This is working the glutes and the back of the leg, which is your hamstring muscle. Now, as you can see, my pressure is on my heels. My knee is right above my heel, and I'm leaning back, feeling that stretch from my glutes and my hamstrings. And that back leg is just there for support. Make sure your abs are tight here, and you are trying to minimize your motion to the muscles in your legs. We're finishing off this exercise with a goblet squat, knees a little more than shoulder width apart, toes pointed outward. Here we're doing a pulsing motion. You can do this again with or without weight depending on your experience with exercise and what you think you're capable of. Listen to your body. You want to warm up with 20 reps at a light weight followed by 3 or 4 active sets of 10 to 15 repetitions, okay? Make sure that you're challenging that muscle. If it's easy peasy and you are rolling through these exercises, you will likely not see the results you're looking for. Don't forget to finish your exercise with a nice stretch to release the lactic acid from your muscles and try to prevent some soreness, although every good workout leaves you a little sore the next day. Enjoy this, and if you love what you see, let me know at Coastal Living TV on Facebook and Instagram. I would love to share more of my workouts with you. Enjoy.
Hey friends, it's Coach Anna from Rock That Fitness. Today I just want to encourage you to stay hydrated. Basically, make sure you're getting plenty of water to drink. I mean, summer is basically here and it gets really hot, especially when we're outside staying active and we're getting our exercise. Hold on just a second. I want to share with you several important reasons why you want to make sure you're staying hydrated. Also, how do you know if you're getting enough water to drink? Making sure you get plenty of water to drink every day has countless benefits to your health and your fitness. Helps improve digestion, helps to flush out toxins and excess salt, helps brain function and alertness, helps us with our digestive system, helps lubricate joints and ligaments, improves skin complexion, slows the aging process of your skin. So many benefits to staying hydrated. But one of the things that I really want to highlight is the importance of staying hydrated while you're outside, especially when you're active and you're getting your exercise in. You're going to be losing a lot of water by sweating, and especially here in Corpus Christi in this Texas heat. Staying hydrated is going to help your body regulate your body temperature. Stay active with exercise or sports and you're outside, or even if you're in the gym. One of my favorite benefits to staying hydrated and getting plenty of water is performance. You're going to see that you are going to perform better in your sport or your exercise. It's going to increase your performance. How much water do you actually need every day? It's going to depend on you. This is a very individual thing. I know you've heard a million times, just drink 8 glasses of water a day. That's a nice guideline. You can use that. Most people do pretty well with about 8 glasses of water. But if you're very active and you sweat a lot, you're going to need more water. It just depends on how much water your body is losing every day. But I want to just give you a simple way to monitor your water intake, and are you getting enough water? Are you staying hydrated? This is very simple, and that is you want to be taking a look at your urine. Yes, this is my nursey answer to this question. If you're seeing that your urine is basically colorless, pale yellow and clear, you're pretty well hydrated, and that's great. You don't want to wait until it turns into that apple juice color. Then you're definitely dehydrated. Don't wait until you're thirsty. Make sure you're drinking water throughout your day. And how can you monitor how much water you've had in a day if you're not counting glasses or bottles of water? This is how I like to do it. I've got a gallon jug here. I chug the jug. Or I pour it in a glass, but all day I can see how much water I've been drinking throughout the day. That's how I do it. Find a way that works for you so that you can stay hydrated. You might be asking, what if I don't like the taste of water? You can use water flavors, at least you're still getting water. But remember, if you're drinking tea or coffee, yes, it still adds to your water consumption, but those are diuretics. So you want to make sure you're drinking a little extra water if you're drinking coffee and tea, because those are diuretic, which means you're going to be going to the bathroom more. Okay. But remember to drink your water, stay hydrated. It's going to benefit your health and fitness in more ways than you think. Stay strong and rock on.
That's been surging for months. Now the CDC says whooping cough cases are the highest they've been in a decade in the U.S., with no signs of slowing down.
And what this bacteria does is it attaches to the cells that line the airways. They're called cilia, the sort of hair-like cells, and damages those cells and creates a tremendous cough.
There have been more than 33,400 cases reported this year through December 21st. According to preliminary CDC data, early treatment with antibiotics may lessen the severity of the infection, but experts say this disease is also preventable through vaccination.
Prior to the 1940s, when vaccinations were not that common in the United States, about 9,000 kids would die per year in the United States.
In the U.S., the vaccine coverage rate that protects against whooping cough was just over 92% for the 2023-24 school year, a decrease from the year before, and coverage for all vaccines decreased in most states.
And as this rate drops, the level of infection in the community rises. And so far this year, we've seen about 6 times more whooping cough than we did last year.
Those at highest risk of getting severely sick include young children, those with certain medical conditions like asthma, and anyone with a weakened immune system.
We can vaccinate children, and we really need to get back to sort of a sane environment where parents are really taught that these childhood illnesses are unnecessary.
For Health Minute, I'm Mandy Gaither.
Show. We want to thank you so much for joining us. We're off to a great start this new year, and we really want to make sure that you feel equipped and ready to achieve all of those goals. Now, with that said, we want to look good and feel good, so we're going to give you some tips on what is trending in fashion for 2025. We have that and so much more to cover, so we look forward to seeing you then. Be sure to visit us online at Coastal Living TV on Facebook and Instagram. Have a good one, and we'll see you tomorrow.